Modern medicine has achieved undeniable success in treating acute trauma, complex surgical needs, and infectious disease. But as this infographic illustrates, the architecture of conventional care is often restricted by rigid, organ-based silos. Multifactorial chronic diseases, conditions driven by lifestyle, environment, and stress, do not fit neatly into these isolated medical specialties. When patients with complex chronic conditions are forced through this fragmented system, the clinical consequence is a cascade of overlapping tests and polypharmacy. We are deploying an expensive acute care framework to treat lifestyle-driven conditions. As the exponential cost curve shows, the current model struggles to balance rising expenditures with patient outcomes. Hospital-centric models are becoming economically unsustainable for the long-term management of lifestyle-driven chronic disease. One proposed solution is integrative medicine, combining conventional care with evidence-based complementary modalities like yoga and Ayurveda. This proposition is supported by a comprehensive scoping review of 312 key medical studies. The review evaluates both the clinical pathophysiology of complementary therapies and the specific cost-benefit analysis of their implementation. This evidence provides a framework to move beyond localized symptom management toward a model of systemic integration. This quadrant diagram maps exactly how holistic interventions categorize across different high-burden health domains. There is a clear functional division between interventions targeting metabolic health on the left and those addressing structural and pain issues on the right. Looking at this clinical problem matrix, we can see the established metabolic evidence. For type 2 diabetes, specific interventions utilizing fenugreek and curcumin yield measurable glycemic improvements. On the structural side, botanical preparations like Boswellia serrata demonstrate moderate evidence for reducing inflammatory mediators and pain sensitization in knee osteoarthritis. For neurological decline, adaptogens like Bacopa monnieri provide low to moderate evidence for supporting synaptic plasticity in cognitive aging. Where conventional medicine often reaches pharmacological limits, complementary modalities provide targeted, evidence-based interventions. Why do these interventions succeed where single-target pharmaceuticals frequently fall short? The biological mechanism at work is multi-system pathophysiological modulation. This systems biology model illustrates how a single complementary practice creates a positive, cascading ripple effect across an entire integrated biological network. Rather than isolating a single receptor, these interventions regulate the neuroendocrine system, balancing the HPA axis and modulating cortisol production. They simultaneously act on the autonomic nervous system, restoring sympathetic balance to address chronic systemic inflammation. This chart breaks down pranayama, a targeted mechanism for inducing this systemic modulation through precise breath regulation. The technique known as nadi shodhana directly enhances vagal tone, triggering parasympathetic activation to address hypertension and anxiety. Conversely, the rapid exhalations of Bhastrika stimulate chemoreceptors to facilitate a sympathetic reset and increase tissue oxygenation. Holistic modalities are clinically effective because they target shared systemic root causes simultaneously, reducing the clinical need for localized polypharmacy. That brings us to the economic reality. Conventional polypharmacy generates significant indirect costs via adverse drug reactions and side effects. Because complementary modalities have a low risk profile, they can reduce these indirect financial burdens on the system. This chart illustrates the difference in the average annual cost of conventional medical care versus complementary alternative medicine. When we successfully integrate these models, the potential cost savings per patient are substantial, particularly for complex conditions like sciatica, dementia, and psychosis. This infographic shows how this works at a scalable population health level, detailing an economic model for community yoga. The program requires a relatively low investment, just £220 per participant annually. By reducing GP visits, emergency attendance, and hospital admissions, that initial output yields a net annual saving of £9.7 million, a direct 4-to-1 return on investment. Integrating holistic care is not merely a patient preference initiative. It is an economic requirement to salvage failing healthcare budgets. Capturing these clinical and economic benefits requires a shift away from hospital-first architecture. We must invert healthcare resource allocation. The foundation of the system must become preventative community care rather than top-heavy acute facilities. The central operational unit of this new foundation is the Integrated Community Navigator model. Community health navigators utilize predictive AI and digital health technologies to detect risk early. They route patients to integrated interventions before a condition escalates into a hospital admission. Hospitals should be reserved as tertiary centers for acute care, while chronic health creation occurs dynamically within the community. How can administrators and policymakers practically build this integrated alternative without disrupting existing acute care? This wheel illustrates the spectrum of integrated healthcare options available to practitioners, ranging from conventional medicine and yoga to acupuncture and herbal remedies. Administrators can rely on this 9-step implementation framework. It begins by promoting cross-disciplinary communication. Step 3 enforces evidence-based practice to maintain clinical efficacy. Finally, Step 5 involves interprofessional education, ensuring practitioners share a common clinical language. When executed correctly, the end result is a realized community-integrated health network operating with measurable efficiency at scale. True healthcare sustainability will be achieved by merging the diagnostic precision of modern medicine with the systemic resilience of holistic community